We begin tonight with some breaking news in Denver. A really bad crash has part of 6th Avenue shut down on the west side of town. Police say somebody got seriously hurt. The eastbound side of 6th is now shut down from Wadsworth all the way to just west of Federal. Tonight, federal investigators are trying to figure out what went wrong with a skydive turned deadly this weekend. It's the skydiving company's 6th death in 6 years. Police in Longmont say a man died during a dive yesterday near the airport. They say he was wearing a wingsuit and his backup parachute never deployed. Mile High Skydiving runs its dives out of Vance Brand Airport. Back in 2019, after a particularly deadly few months of diving, they told us many of the victims then were extremely experienced, often challenged themselves. We reached out to Mile High Skydiving to ask about this weekend's accident. They didn't get back to us. Longmont Police and the Boulder County Coroner will work with the FAA on this investigation. Police in Denver say one of the men shot on an RTD bus last night has now died. The other victim is expected to survive. That shooting happened on the bus as it drove through the west side of town near Federal and Mississippi. Police have not shared any details about what led up to the shooting, and there have been no arrests either.
Shouting, screaming for help that her son was being killed.
A man is now in critical condition tonight after getting attacked by a dog in Boulder. Police in Boulder say they had to shoot and kill the animal because it was threatening other people and tried to attack an officer too. Neighbors told us they watched that dog attack one of its owners.
The mother, she kept looking at me and she said, "We've owned him since he was a puppy. He's never done this."
Neighbors say they saw officers first tase, then shoot that dog. The victim is still in the hospital. First responders in northern Colorado braved some really tricky conditions to rescue a climber trapped in a tough spot in Poudre Canyon. Poudre Fire had to climb up, wrap the injured climber in a rescue stretcher, then work their way down off the cliff face this afternoon. It took crews about 2.5 hours to make it down, then cross the frozen river. They shut down Highway 14 to give first responders some room to work. They used a helicopter to bring that climber to a hospital. No word on how badly they got hurt. A United flight had to make an emergency landing at DIA today because its windshield cracked mid-flight. The FAA says the plane was on its way from Las Vegas to Dulles International Airport. It landed safely just after 1 today. Now we are going from a beautiful weekend to a lovely week. Clear skies, calm winds, warm temperatures, all of this before our next storm system moves into the state. Gonna be a jam-packed week, Lauren Robinson.
That's right. We have a little bit of something for everyone. And I know there are some people that want the break in between the storm systems and others are like, it's still winter. We want more snow. Well, there is some more on the way for next weekend. In the meantime, hey, if we're getting dealt sunny skies and 60s in the middle or end of January, I say we revel in it. Now, today we saw highs near 60 degrees at DIA. Most of the Front Range and Eastern Plains was in the upper 50s to low 60s. We were a tad bit chillier to the south, a high of just 56 degrees in Colorado Springs and in Trinidad. But we did see a high of 72 degrees over in Springfield. The high country saw 30s, 40s, 50s, and we were in the upper 40s to middle 50s across the western slope this afternoon. Now those temperatures have cooled down mostly to the 30s across the Front Range and Eastern Plains. The chilly 25 degrees right now in Lyman. Single digits all the way to the 20s and 30s in the high country, 20s and 30s out west. I'll have more details on the sunny, warm week ahead and next weekend's storm. All of that just ahead of my 7-day forecast.
Thank you, Lauren. 2 weeks after the MLK weekend mountain travel meltdown, if you will, that turned I-70 into a parking lot and emptied store shelves in Silverthorne, leaders there are now trying to find better ways to handle traffic messes. When storms shut down I-70 and an avalanche closed off Berthoud Pass, all that ski traffic made a beeline for Silverthorne. Quick trips through town turned into hour-long slogs, sitting in traffic. In a meeting this week, the town council says the roads were so bad, police had trouble responding to 911 calls. The mother, who is accused of killing 2 of her children and hurting a third, days before a court-ordered custody swap, is now due back in court tomorrow. Kimberly Singler made it all the way to London before police in Colorado Springs tracked her down. Police say back in December, Singler killed 2 of her young children, then called 911 and said a burglar did it. 9 News obtained court documents detailing Singler's intense custody battle with her ex. She was supposed to bring those kids to their dad for a long visit days after the killing. Singler is due in court in London tomorrow for a hearing on her extradition to Colorado. A criminal justice professor at MSU and former DA says investigators in the Springs are likely getting help from the feds to prepare.
The rules say that once she's been arrested, there are 60 days in order for them to get all the information, get over there, prove it to the judge. Here are the crimes, judge. Here's all the evidence. Here's the detailed affidavit. Here's the evidence that we can show, the pictures.
Denise Mauder says Singler would be able to appeal extradition, but she thinks that's unlikely to succeed. Denver is once again capping migrant families' time in the shelters. Next week, they'll start being forced out, leaving community partners to look for homes for more than 800 families. 9 News reporter Angeline McCall was there as a panel of migrant women, service providers, and advocates all got together to talk solutions.
And all be all. We're just concerned women who came together and called out other folks to come here, and you've joined us. So
thousands of migrants in Denver are looking for help. Help they hope to find from the discussion at Town Hall Collaborative on Santa Fe.
Aquí realmente mi propósito es trabajar y salir adelante y ayudar a mi familia.
Migrant women here have discussed the challenge of finding work and housing.
Es muy duro. Tienes que sacar fuerza donde no tienes porque hay momentos en los que ya no quieres seguir.
Advocates want more help for people who may not be able to navigate the system themselves.
We also need to make the federal demand for work. That being said, at the state level, the work permits that have been mentioned that are so critically needed. At the state level, we can have policies that make it easier to attain those temporary work permits. We can have programs and assistance.
For those without ideas,
I'm having a really hard time reaching the youth.
They came not with suggestions, but with questions on how they can help.
But in terms of directly being able to host a migrant family, it is something that my wife and I would definitely be interested in doing. What's the best route for us to go besides just Googling it? Because I feel like you guys are going to have a better answer than that.
Questions advocates feel more people need to ask in conversations like this one.
So this story of, but I'm just one person and I don't know what to do, is completely fake. Just do it. Just open your door and let people in and ask for help.
Billy Casas with Vive Wellness says that now is the time to have conversations like this one, especially because more families than ever will be exiting the shelter all at the same time. Again, like we mentioned before, 800 homes they're looking to place families in, whether that means leased apartments or a spare room in someone's home. Jenny.
All right, Angeline, thank you. Soon, women will have a simpler way to access one type of contraceptive. The first over-the-counter birth control pill will soon be released, something women can now buy at the store or even online. 9 News reporter Rachel Krause talked to a doctor who's excited for this big shift, but doesn't want preventative care to suffer.
I think this is a significant expansion, to be sure.
The first over-the-counter birth control pill, called O-Pill, will soon be available at the pharmacy and even online. Dr. Spencer McClelland, an OBGYN at Denver Health, says this expansion to reproductive freedoms will benefit women in Denver and all around the country.
It's something that we're tracking as an option for our patients because we're always looking for the ability to expand access to birth control, especially given that barriers to birth control tend to be something that our patient population at Denver Health has to worry about when it comes to insurance coverage or ability to pay.
When it comes to accessing birth control or staying on top of a regimen, one barrier facing many women is the need to come in for a visit to get a prescription or contact providers to get an updated prescription. A study from KFF found 1 in 3 women who use contraception say they've missed their birth control dose because they couldn't access the supply they needed on time. Dr. McClellan says O-Pill could break those barriers down.
I think this is a really exciting moment in terms of access for reproductive care. And the part that I think is really exciting is not just that something has been added as an option for patients, but that it's in a way that is specifically trying to think about what barriers there are for patients accessing birth control.
This over-the-counter option comes at a time when pharmacists in more and more states, including Colorado, can write prescriptions for birth control in the pharmacy, bypassing the need to see your doctor altogether. But McClellan says don't skip out on those annual appointments. Beyond the birth control prescription, he says those checkups are critical when it comes to identifying health concerns early on, particularly with cervical cancer screenings.
There's so much more than just birth control prescriptions that come from annual exams. There's a lot of health screening like pap smears and other healthcare screening that we want to make sure people still come for.
Now, doctors say with O-pill specifically, it may not benefit as many women as other medications might, and that's because it's a progestin-only type of birth control, whereas most are a combination of progestin and estrogen. But he says the FDA making O-pill accessible over the counter is still a massive step forward, and we could see other forms of birth control follow suit.
Pretty interesting. Okay, Rachel, thank you.